All right, the president revisiting an issue he touched a lot of controversy with yesterday, the use of hydroxychloroquine, saying that he was not fairly characterizing it, and a lot of his medical supporters said it was misinterpreted. What is not misinterpreted is that there have been at least 4 prominent studies on the use of hydroxychloroquine for other issues beyond lupus and malaria, for which it's more popularly used and for which there have not been any real noteworthy problems. The issue here is whether it is advisable to take to ward off COVID-19, and no less than the Food and Drug Administration had warned back on April 24th that hydroxychloroquine and chloroquine have not been shown to be safe and effective for treating or preventing COVID-19. And still another study by the New England Journal of Medicine, this one a Columbia University task force that looked with the Irving Medical Center at some 1,300 patients taking hydroxychloroquine as a way to ward off COVID-19. 60% of the patients who received hydroxychloroquine for about 5 days did not show any lower rate or risk than those who did. So the bottom line, if this was supposed to be a remedy for hydroxychloroquine, there was no statistical evidence of that. The study that looked at veterans of the VA, there was a study that looked at them and the vulnerable population, several of whom died taking this. Now, it has been dismissed as saying that this was a rigged study, but it did show that those with vulnerable conditions such as respiratory or cardiac issues ultimately died. Now, statistically, it was significant enough to show in that population of those taking it, it did no good, and in some extreme cases, killed them. There are at least 5 other studies out there. None of this is to say that hydroxychloroquine it can't be used for other uses, namely malaria and namely lupus, its 2 most prominent features. As a preventive, though, when the Food and Drug Administration itself is saying it's not advisable and an out of clinical trial basis is risky to do, that should suffice the argument right there. But again, this has just only come up again because the president was raising it again, responding to questions as to whether it might be premature for White House physicians to allow